the occipitocervical junction on that side, gap C0 from C1, and by that mechanism decrease intra-articular pressure and increase movement. So
same for extension and for flexion.
exactly, it will be the exact same manipulation. So that's nice because in an exam setting, if you get a left C0 extension restriction, that's the exact same manipulative setup as a left C0 flexion restriction. So left-sided manipulations will be identical for C0, C1. Right-sided manipulations likewise will be identical for C0, C1, flexion and extension. So from here, if I can have a volunteer to lie face up on the table, kind of have someone in the zone already. Good. So thinking about the idea that we'd like to gap or open this joint, and that's really our primary objective. How can we best achieve that? Well, the way that we'll do that here is by making contact. Let's say we have a right C0 flexion restriction. So in order to address this, we can take our fingertip contact using the first two fingers under the mastoid process on the affected side. So here's our hand contact. Next, we're going to rotate so that that side is facing all the way down. And this is basically going to allow us to better isolate our forces to this area. But in order to do that, we need to have another contact here on the skull. So that's what we'll do. And there are some different options for this hand contact. Typically though, you'd like to have a broad distal palm contact at the sort of posterior aspect of the zygomatic arch. So you don't want to be way up here on the arch, but we're more right where it begins. And so from here, we're going to take our pretension by laterally flexing in this way, just at C0, C1. So we're going to be pushing inferiorly, gently with our top hand, while our contact hand pulls gently towards us. That's how we get our pre-manipulative tension here. As far as doing the manipulation, doing the manipulative thrust, what we'll do is 95% push and pull. So from here, that looks like this. This is 95% of our movement. Our upper top hand is pushing inferiorly, while our manipulative contact hand pulls superiorly, 95% of our force. 5% is going to be directed into rotation, simply to free up that accessory movement and allow that gapping to occur. So in practice, with our 10% practice thrust on an exam, it would look like this. Find our pretension there, release that pretension, and then that's going to be the appearance of that manipulation. So, any questions on how that one's done?
You're pulling out toward yourself with the long hand.
Exactly, yes. So out towards yourself, and I'd encourage you to experiment with standing during this manipulation because it gives you better leverage from which to push and pull, as well as a really stable base. And this is one where oftentimes a little bit more amplitude is required to really get this motion, and we want to make sure that we don't slip, either by rolling on a stool or by having our hand slip on the patient. So this is just a good one to make sure that our contacts are extra secure when we're performing. Good. Any other questions for this?
So again, you turn towards the side that's being manipulated.
Exactly.
Okay.
So we could say affected side down or turn towards the affected side. Yes. Good. Okay, so before we practice this setup on one another, what I'd like us to be able to do is also practice this kind of light 10% thrust so that there's a good idea of where the force is going. This is a little bit different from some of our other manipulations. So to do that, I'll show you a drill that can give you some similar sense of what that motion should feel like. So for this is our patient's head, impossible to hurt. And what we'll do is take our same two-finger contact here, envisioning a mastoid process, and here, envisioning that zygomatic arch. And what we'd like to do is practice this motion. So we're pulling towards us, pushing downwards, and incorporating that very slight 5% rotation. And what you'll find is that if your force is sufficiently coupled between your two hands, if they're moving in a synchronized fashion, then the two pillows won't really slip too far on one another. So if your hands aren't very well synchronized, you'll do something like that. And of course you can imagine the sorrow that that would cause in a real patient. But instead what we'll look to do is really tightly couple these two motions. And here you can sort of play with this idea of 5% rotation. That's something that's a little bit hard to get just by thinking about it. So you'll be able to practice and say, okay, well that was too much rotation. How can we make that a little less? And right about there is the way that you'd like that to be. So again, your pulling hand is going to be doing just what it was doing for our digit pillar pull manipulation, which is to extend the shoulder, so moving backwards like this, as well as to retract the scapula, moving the shoulder blade in towards the spine. So those are the two movements that are happening with your pulling hand, and your pushing hand is just pushing inferiorly and downward to couple with the movements of your manipulating hand. So. Questions